Hello, everyone, and welcome to Great Talks podcast. I'm Danny, and today I will talk to Alton Lavering, the COO, and Rachel Hopkins, the CEO of the Child Investment Partnership of the Roanoke Valley. If you don't know them yet, they are an early childhood home visiting program that helps families to get access to needed medical services, also to assist with management of chronic conditions, and to provide developmental education, kindergarten preparation, and regular child assessment. But just before we begin, let me give a quick reminder to those that are coming here for the first time and those that haven't done that yet. Remember to subscribe to our podcast either on YouTube or in your podcast apps. All right. Hello, Rachel. Hello, Alton. Welcome to the Great Talks.
Hi.
Hello.
Thank you for inviting us and reaching out.
Our pleasure. I'm actually quite excited to talk to you guys today, especially because it's not often that we have two guests here. So it's always nice to have more people chatting. And my first question to you, I think it's important for all of us to understand the context that you are. So where exactly is located the Roanoke Valley, and what is the context situation, the social situation that you're seeing there that put you into action?
We're located in the Roanoke Valley, in the state of Virginia, and we serve families that live in poverty. Poverty is a dirty word, but it's an unavoidable subject. And we are really there to provide support and kind of wrap our arms around these families and help them get through pregnancy, through early childhood. Let's face it, being a parent is not easy. I think most people would agree. You need a village, and we want to be that village. And we're proud to do that for families all across the Roanoke Valley.
Oh, that's a great point, I think, because I always say this. I'm in Brazil, and sometimes the realities that we see are different, but some points are not, right? And this early childhood is such a precious and important moment of a family life, not just the child, because it's a moment of adjustment for everyone, right? It's a moment where your whole life changes. You're usually going to get very little sleep. And it also affects other points in life. So it's interesting to see how you are answering to those problems, especially on less wealthy families, right? And Rachel, if you could, how exactly has the organization been working so far to provide this help?
Okay, that's a great question. So my perspective on it is somewhat fresh and early because I've been here only since December serving as CEO. But I can tell you that one of the reasons that I chose CHIP as a home to serve in is because at the very heart of everything we do is a relationship. And I think that's one of my friends said that's the secret sauce. But what I think that is in our community, we have resources. We have folks that show up and may provide you with food, may provide you, which is so critical. But CHIP is there first and foremost to create a trust-based relationship. And a trust-based relationship, I believe, opens the door for transformation, not only within the context of what we do, but in life, right? This is what happens in life. In life, you get to a safe place and you start to open up and be vulnerable and say, these are my needs. This is what I need in this moment. And this is what, I need as a mother. This is what I need as a child. And we have a holistic approach to that. I think in parenting, there's so much focus, being a mom myself, on what's good for the child. You have to have equal balance there. A family is a unit, and families look very different, and CHIP serves all different types of family. Our definition of that is very broad. So for me, I like to really highlight that relationship because it's what sold me, and it's why, I always say I have fallen in love with this organization, and I sit here in admiration of everyone who works here, right? And our families. It's they're incredible folks. So
Yeah, I always like to hear that, because it's truly what we want to see, right? Whenever we are betting or we are trying to help with someone that is, how passionate are you about this project, and understanding that you really got involved by the way you approach it's fantastic. And I agree with you completely. I think you need to go to the ground. You need to be with people to understand their needs. It's different. One thing is a paper, one thing is what is written down, what a book says. Another thing is when you hold your child
Mhm.
and then it's you and the baby. And well, what programs do you have? Maybe you or Alton can tell me that, running right now to offer support to the families.
So we start when mom is pregnant. We start services right away, and then we have services from children that are newborn to first grade entry. And so our services are providing a home visitor who kind of guides the caregiver through developmental education, is connecting the family to community resources. And as the child progresses closer to school age, is beginning to help the family prepare for kindergarten readiness. All the documentation that's required, that's not an easy process. And then the unique component about our program is that we also have community health nurses that are able to provide a lot of health education. They're doing medical assessments. So we do things like NICU management. We do asthma case management. There's a lot of really incredible components to our program. And then, we are also able to provide the community, or just like the everyday needs, diapers, formula. That's a huge crisis in the United States right now. And we're able to help facilitate some of those needs, home safety items. But really, like Rachel said, it's all about that trust relationship. That's the key component in everything.
Mhm.
Yeah, absolutely. I completely relate with the idea that takes the village to raise a child, not in the sense of how many hands it needs, but of the help, the different influences that kids need growing up, and also the parents, right? And it's definitely an outstanding idea to not only provide like physical help, like of course to have, as you said, a crisis now with formula. Diapers cost like it's ridiculous. We usually don't think about that, but being there and providing like emotional support, it's just precious. It's vital. And do you have an idea of how many families are you helping right now, like in numbers, so we can have a broad understanding of that?
Yeah, sure. Right now, we're around 300 families, close to 1,000 individuals, and that's coming out of, I'm nervous to say it post-pandemic because we could slide reckon, but our number and where we're going to be by the end of this next fiscal year, a year from now, roughly, would be closer to that 400 mark. Each of our teams, that consists of, as we mentioned, a family case manager and a nurse. They see their families once a month, and they carry a caseload, meaning how many families they maintain that relationship with, of approximately 40, not to exceed 41, 42. So it takes time. It takes time to, how many, that takes time. So I think it's, for us, the quality of that relationship is what is most important. And over a period, 5 or 6 years, it's a long time. I know Autumn mentioned that from pregnancy on, another thing that's really special about CHIP is that we have grandparents that are raising children. That's something that, especially in the last decade, has been on a steep increase, and that is grandparents raising children, or family foster. We work with foster parents. We work hand in hand with the foster care system, and so whoever you are, when you have a child of that age and you want partnership in that process, that's where we come in.
Wonderful.
Another unique component too that I should have mentioned was we offer mental health services. So we have a building right next door to us. We have a director of mental health, and she provides traditional talk therapy as well as play therapy. And that's really a critical need. I mean, it is hard to parent when you are still dealing with your own trauma that you experienced as a child. And that's, I think, just such an incredible service for our families, and really a change maker, if you will.
Yeah. And the other thing that our very brilliant director of mental health services provides is there's several instances where both perhaps a child and a parent is in counseling. Maybe child is in play therapy and parents in traditional talk therapy or play therapy. And the power of that, of two folks in a household that say, I'm committed to this, right? Things happen. And I think it's pretty powerful, and something, especially in the next 5 years, that we're expanding. We're putting a lot of emphasis on expanding the presence of mental health initiatives with CHIP.
Wow, that's truly a game changer. I think that I think I was talking to this with my parents probably a few days ago, that how each generation kind of grows in a certain direction, right? So years before, my parents' struggle was to get us financial situation that would be safe and provide for. Now I feel like my generation as parents, we want to provide like mental and psychological safety to our kids, right? And that's definitely something to think of. But when you were speaking, Rachel, I thought about it. I didn't know why I asked before, but how was the situation for you guys during the COVID pandemic? Because especially since you're offering some assistance to asthma kids, that must have been quite complicated for you.
Yeah. So while I wasn't here, so I'll do my best. I started after that, but I certainly have listened to and studied how CHIP approached that. And so, of course, everyone's needs changes because our families, their needs became more urgent and acute. So it was more what I need today rather than a protracted plan or need. I think those were complementary, but I know this team here stopped what they were doing and said, all right, food, diapers, clothing, support with education. How are we going to get through shifting to virtual education, childcare, all of the things that maybe if you aren't facing some of the situations financially, you certainly take for granted, right? These challenges. And so CHIP of the Roanoke Valley stopped. And Autumn tells me there were times when the halls were just filled with bags of groceries, diapers, and just being there. And I think I'll just tell you, when a family here has need, whether it's during the pandemic or not, people here stop and they figure it out. I've never heard someone say, well, that's not what we do, right? You wouldn't do that for someone you have a good trust-based relationship with. So I don't think I can capture in words what CHIP did for the community during that time and what they did for their families, because it was probably so varied and just in direct response to vulnerability, someone saying, I need this. And the relationship being there, they could express that and they responded. So
I mean, we, within 2 weeks of COVID becoming a national pandemic, started getting resources out to our families. So at that point, I mean, toilet paper was hard to find, mask, hand sanitizer, and through a lot of our generous partners, we were able to acquire a lot of those things and get them out to our families immediately. So not only the practical things, but then, the schools were shut down. And everybody's staying in their home. So we were able to provide activities to keep the kids busy. And I myself can, I mean, that something so small like that was just a relief. It was something fun. It was something different. And we continue to serve our families day in, day out. It was all about pivoting, and our team did a beautiful job. and continues to do a beautiful job of pivoting.
Wow, it's really good to hear that about your community. Yeah, I wish more places were like that, and I hope this idea is kind of spreads on. And now, unfortunately, getting almost to the end of our interview, two final questions for you. First one is, how can the families in need get in touch to get help? And the other one, how the families that are not in need can help you guys out, keep doing this amazing job.
Give us a call, go to our website, Facebook. We can, and I'm sure you can share some of this information with your podcast viewers, but you know, a lot of families reach out to us by calling directly. You know, we're going to get in touch, right in touch back with you if we can't help you in that moment. Go to our Facebook page or go to chiprv.org, and you know, we're going to put you directly in touch with our amazing enrollment manager, who's just, you know, that's your first point of contact, and she's going to make you feel comfortable in that process and get you to where you need to be.
And for folks that, you know, want to make a difference in the lives of the families that we serve, there's a variety of ways that you can help. We always need volunteers. A little known secret about CHIP, our basement is full of clothing, toys, diapers, books. So if you have things to donate from your household and your local, bring them to our location. You can also shop from our Amazon wish list. And then also make a financial donation on our website. I can tell you that every single dollar makes a difference. So even a $5 gift is life-changing for our program and the families that we serve.
Amazing. And do you have any final messages, either you, Autumn, or Rachel, to our listeners today? Any final appeal or a message?
No, just I just want to say, you know, we're here and we work with really, you know, our families are some of the most courageous folks. I'm constantly inspired. Our team. One of the things that, you know, we just updated or about to our core values, and what I'm really proud of, and I think it sums it up, is that, you know, we're courageous and we use compassion and creativity to overcome every barrier, and that's really who we are as a CHIP family. All, you know, for everyone. So that's it.
Perfect. And thank you so very much for joining us today. This was a wonderful call. I loved hearing more about your work there. And for everyone listening, also, thank you for staying here with us once again. And if you enjoyed this conversation, remember to like it and subscribe it on YouTube or in your podcast app, because that shows the algorithm that this is an important conversation and more people learn about the importance of the Child Health Investment Partnership, CHIP, of the Roanoke Valley. Bye, guys, and see you at the next episode.